Imagine discovering something hidden, something serious, a problem that's been silently building maybe for a very long time right under your nose. Today, we're doing a deep dive into exactly that kind of scenario, but specifically for horses, mares, actually. We're talking about equine pyometra, and let's just define that right away. It's basically when a whole lot of purulent material, pus, builds up inside a mare's uterus, a large volume. Our mission today is to pull out the most important insights from the sources we've looked at, kind of giving you a shortcut to understanding this really serious but often incredibly subtle condition. And there are some surprising things, like how different it is in mares compared to other animals. I'm really curious about that part.
Yeah, that's a great starting point because it really gets to the heart of what makes equine pyometry so, well, unique and frankly, pretty challenging. The key thing isn't just that it's an infection, it's the huge volume of pus we're talking about and the fact that it gets trapped inside. We mean liters, sometimes, tens of liters of material stuck in there. And if it's not treated, absolutely, it could become life-threatening.
Wow. So it's the sheer scale, the amount of pus, and the fact it can't get out. That's what makes it so dangerous. How is that different from pyometra in dogs? Because you often hear about dogs getting really sick really fast with it.
Exactly. That's the crucial difference. In mares, what really sets this apart is that it's almost always linked to the mare not cycling normally. It's an anovulatory condition. And that's vital because it means the cervix, which should open up during heat, during estrus, to let things drain, it typically stays functionally closed,
Yeah.
stubbornly shut, which naturally prevents that pus from escaping. So it becomes this chronic, often very subtle kind of smoldering problem.
Okay, so less like a sudden five-alarm fire and more like a hidden blocked drain pipe situation.
Precisely. You've got it. It's not just about bacteria being present, though they definitely play a role. The primary fundamental issue is impaired uterine drainage. That blocked drain pipe analogy is actually perfect. The cervix should open, but because of the hormonal situation, usually too much progesterone influence when she's not cycling, it stays functionally closed. And this creates this awful stagnant environment inside the uterus. It leads to really significant destruction of the uterine lining, the endometrium, loads of inflammation, and it can even cause permanent damage like atrophy of the glands in there. This whole inflammatory mess also messes with the production of a hormone called PGF2. That hormone normally helps the uterus contract and clear itself out. So when its release is suppressed, it can actually prolong the progesterone effect, keeping that cervix clamped shut even tighter. It's a vicious cycle.
That makes total sense. So yeah, it's not just fighting bugs. It's fundamentally about getting that drainage pathway open again. Okay, so given how critical that drainage failure is, let's unpack why it happens. What leads a mare down this path?
Well, the sources we looked at are pretty clear. You essentially need two things happening at once. You need some kind of bacterial infection, getting a foothold in the uterus, yes. But crucially, you absolutely must have that impaired uterine drainage. Without the blockage, the mare's body would probably just clear the infection on its own.
Right. The blockage is the real enabler. So what causes the blockage? Is it always like physical damage?
Physical or structural problems are definitely a major factor. Damage or dysfunction of the cervix itself is a big one. We often see it resulting from previous difficult foalings, dystocia, as it's called. Things like tears, scarring, fibrosis, they can all stop the cervix from opening like it should. Also, chronic inflammation of the cervix, cervicitis, if it goes on long enough, can cause scarring and narrowing, what we call stenosis. Even poor conformation in the mare's rear end can contribute. Things like a sunken anus, or if the vulva slopes incorrectly, wind-sucking, people call it. That allows air and bacteria in, leading to chronic irritation and inflammation back there, affecting the cervix too. And much less commonly, you might find something like persistent hymenal remnants physically blocking the way out. We also tend to see it more in older mares. They're just more prone due to age-related changes, especially if they've had multiple foals or uterine issues in the past.
So often it's like a ghost of problems past or just how the mare is built, kind of setting the stage. Does that mean dealing with something like wind sucking early on could potentially prevent this whole pyometra nightmare later? Or is it more complicated?
It's definitely more complicated than a simple cause and effect. But yes, addressing those predisposing factors, like surgically correcting wind sucking with a Caslix procedure, can certainly lower the risk of the chronic inflammation that can lead to cervical problems. But it's not just the cervix. Problems within the uterus itself can also play a role. Chronic endometritis, sort of a low-grade persistent uterine infection, can sometimes escalate into full-blown pyometra. Or large uterine tumors, or even extensive endometrial cysts could physically block drainage from within the uterus. Sometimes adhesions, like scar tissue between the uterus and other organs in the abdomen, can stop it from contracting and emptying properly. Or just the fact that the uterus has been chronically stretched out might impair its ability to contract effectively. And, like we touched on, the hormonal side is huge. Those anovulatory cycles, or if a mare gets stuck in the diestrus phase for too long, that means progesterone keeps the cervix closed, making her highly susceptible if bacteria happen to be around. A lot of these cases are in mares that just aren't cycling right. Very rarely, you might even find a foreign object, like a glass breeding marble that was put in and never removed, or broke, acting as a constant source of irritation and infection. And then sometimes you do all the tests, you just can't pinpoint the exact reason for the drainage failure. It remains unknown.
Wow, it really sounds like a complex puzzle, so many potential pieces. And, okay, you mentioned bacteria being involved. Our sources list the usual suspects, right? Strep zoo, E. coli, Klebsiella. But the real takeaway isn't just which bacteria, it's why they get the chance. They're opportunists waiting for that blocked drain.
Exactly. That's the crucial point. You'll find bacteria like Streptococcus, equal subspecies Zooepidemicus, E. coli, Klebsiella pneumonia, Pseudomonas aeruginosa quite often. And you can get mixed infections, even yeast or fungi sometimes, but they aren't the primary driver. The drainage problem is what throws the door wide open for them. Without that underlying issue, the mare's own defenses would likely handle them just fine.
Okay, so with all this significant internal stuff going on, this massive accumulation, you'd think the mare would look really sick, right? But what's kind of mind-boggling about equine pyometra is how incredibly subtle it can be, almost sneaky.
Oh, it's remarkably subtle, truly. Unlike in dogs or cats, where pyometra often makes them acutely, severely ill very quickly, mares are incredibly good at, well, just holding on to all that pus. Systemic signs like fever, being off feed, depression, they're typically mild or even totally absent until the condition is very, very advanced. Often the very first thing an owner notices, or the reason they call the vet, is just poor reproductive performance. The mare is presented because she's not cycling or not getting pregnant, or maybe showing intermittent signs of heat. That's frequently the main clue, sometimes the only clue.
And here's that detail that just blows my mind. The abdominal distension. You said mares can have liters, even up to 100 liters of pus inside. And a swollen belly might be the only sign you see in a mare that otherwise looks pretty healthy. How is that even possible?
It really speaks to their stoicism, doesn't it? It's incredible what they can tolerate internally without showing much distress. Other signs you might see include intermittent vaginal discharge, maybe just a little bit, sometimes after exercise. But often, because that cervix is clamped shut, there's no external discharge at all, which makes it incredibly difficult for owners to pick up on. If there's discharge, it can look watery or milky or obviously purulent. In really chronic, long-standing cases, yeah, you might eventually see some weight loss or the mare looking a bit unthrifty, lethargy, depression, usually only very late stage, maybe if things are getting toxic. And laminitis is possible, though thankfully rare, as a consequence of that chronic inflammation and toxemia. But the bottom line is, affected mares are pretty much always infertile while the condition persists. And sometimes, believe it or not, it's just found by chance during a routine breeding soundness exam or an ultrasound for another reason, an incidental finding.
Okay, given how sneaky this whole thing is, how do vets actually nail the diagnosis? It sounds like proper detective work is needed to uncover this hidden problem. What are the key diagnostic steps?
It absolutely requires a systematic approach. It usually kicks off with a really detailed history from the owner. We're listening for those flags, infertility, weird cycles, any history of difficult births, previous uterine infections. Then the physical exam. Transrectal palpation is critical. You can feel the uterus is enlarged, distended, filled with fluid. Sometimes it feels kind of doughy or even firm. If the pus is really thick, it can be absolutely massive. And importantly, when you palpate the ovaries, they're typically small and inactive. No significant follicles or corpus lutea.
So feeling that big fluidy uterus plus inactive ovaries immediately points away from something like pregnancy, right?
Exactly. It tells you she's not cycling normally, which fits the pyometra picture. Then transrectal ultrasound is really the clincher. It confirms there's fluid in there, and crucially, it lets us see what kind of fluid. Pus usually looks different from, say, clear uterine fluid or amniotic fluid in pregnancy. It's often described as hypoechoic, meaning dark, but with swirling, bright flecks in it, flocculent, echodense material. Very characteristic. Ultrasound also lets us assess the thickness and condition of the uterine wall, and sometimes we can even spot those rare foreign bodies, like a glass marble. A vaginal exam using a speculum usually shows that cervix is tightly closed, maybe looking scarred or distorted, and typically no discharge visible coming out. Now, uterine culture and cytology are vital, but we usually collect those samples after we've managed to get some initial drainage. Those samples tell us exactly which bacteria or maybe yeast or fungus we're dealing with, and the cytology shows tons of neutrophils, inflammatory cells confirming the infection. A uterine biopsy is also really important, but more for prognosis. We take that later after the acute infection is under control to see how much permanent damage there is to the uterine lining. Blood work, like a CBC and chemistry panel, is often surprisingly normal. Maybe a mild hint of inflammation or slight anemia in some long-standing cases, but often unremarkable. And finally, in some tricky cases, endoscopy, putting a small camera inside the uterus, might be used to look for things like adhesions or foreign bodies.
Sounds like a very thorough process, putting all those pieces together. I imagine you have to rule out a few other things, too. What else could look like this?
That's a good point. Given the enlarged, fluid-filled uterus, the main thing to differentiate it from is, of course, pregnancy. But as we said, the ultrasound appearance of the fluid plus the inactive ovaries usually makes that distinction clear pretty quickly. In a mare that could be pregnant, you might also consider placentitis, an infection of the placenta. But again, the clinical picture and ultrasound findings are usually different. And sometimes, believe it or not, a massively distended urinary bladder felt rectally could potentially be confused with a fluid-filled uterus initially, but ultrasound sorts that out easily. So yeah, it's about combining the history, the palpation findings, especially those inactive ovaries, and that characteristic ultrasound image of the uterine contents.
Okay, so let's say the diagnosis is confirmed. If you're an owner facing this, or just someone who cares about horses, the big question is, what can actually be done? The treatment sounds like it must be pretty intensive, maybe a long haul.
It is definitely a multi-pronged approach, and it often requires significant time and effort. The absolute cornerstone, the most critical step, is establishing drainage. So, cervical dilation and uterine lavage. That often means carefully, manually dilating the cervix. This can be tough, especially if it's scarred, and you have to be incredibly gentle to avoid causing more damage. Once you can get through, the uterus is flushed repeatedly. We use huge volumes, liters and liters of warm, sterile saline solution, flushing and siphoning, until the fluid coming back out runs clear. And it's vital to make sure as much fluid is removed as possible each time to stop it just filling back up. Sometimes adding N-acetylcysteine to the lavage fluid can help break down really thick, tenacious pus.
Wow, that sounds incredibly hands-on. Just physically getting that uterus flushed out must be quite the process for everyone involved.
It really is. It takes patience and persistence. Alongside the lavage, systemic antibiotics are crucial. Ideally, they're chosen based on the culture and sensitivity results from that uterine sample, but often we start with broad-spectrum coverage while waiting for results. And treatment is usually long-term, think 2-4 weeks, sometimes even longer. We might also infuse antibiotics directly into the uterus after a lavage session, but honestly, the drainage is the most important part. Flushing the bugs out is key. We also use drugs called ecbolics, like oxytocin. Given after lavage, oxytocin helps stimulate the uterus to contract, hopefully expelling any remaining fluid or debris. PGF2 alpha might be used too, especially if there happens to be a persistent corpus luteum on the ovary, keeping progesterone levels high, although that's not typical in these anovulatory cases.
Okay, and what about those underlying structural issues you mentioned, like the cervical damage or the windsucking? If that's the root cause, does that need fixing too?
Absolutely. If there's an identifiable underlying problem, it needs to be addressed if possible. So, if poor conformation like windsucking is contributing, performing a Catholic surgery is important. If there's significant cervical scarring or damage, sometimes surgical repair, a cervicoplasty, might be attempted, though success can be variable. There's also a procedure called a cervical wedge resection, which basically creates a permanent opening in the cervix for drainage. But crucially, a mare can't carry a foal after that, so it's a salvage procedure for comfort, not breeding. Other surgeries are pretty rare, maybe removing an ovary if a hormone-producing tumor was the cause, and in really extreme, unresponsive cases, a hysterectomy removing the uterus entirely might be considered as a last resort to save the mare's life or ensure comfort, but that's major high-risk surgery.
It certainly sounds like a battle, doesn't it? Fighting the infection, dealing with the drainage, fixing underlying issues. So what's the realistic outcome? Can mares fully recover from this?
That's the really important question. And for prognosis, is kind of a tale of two parts. It's a critical distinction to make. Generally speaking, the prognosis is good for the mare's survival, but it's usually guarded to poor for her future fertility.
Ah, that's fascinating. Good for survival, but poor for breeding. Why the big difference, even if the treatment clears the infection?
Well, survival is generally good because, as we said, Equine Pyometra rarely causes life-threatening systemic illness like acute sepsis or uterine rupture, unless things go very wrong, which is thankfully uncommon. Mares are pretty tough when it comes to chronic uterine infections. However, the fertility prognosis is often poor because that prolonged exposure to large amounts of pus and intense inflammation causes severe and often irreversible damage to the uterine lining, the endometrium. We're talking extensive scarring, fibrosis. The delicate architecture needed to support a pregnancy gets destroyed. That endometrial biopsy we mentioned, that helps us assess the degree of this permanent damage. Sometimes there's so much atrophy the lining just can't recover no matter how well we clear the infection. I've seen cases where the infection is completely resolved, the mare seems healthy, but her uterus is simply incapable of establishing or maintaining a pregnancy afterwards.
That's incredibly tough. So it's not just about beating the infection, it's about whether the battlefield itself is too damaged to ever function properly again.
That's a very good way to put it, exactly. And other things influence that fertility outlook too, like how long the pyometra was present and how much pus accumulated. Bigger, longer cases tend to mean more damage. Whether we can actually fix any underlying cervical problems makes a difference. The specific type of bacteria can matter. Some are just notoriously difficult to eliminate completely. And the mare's age plays a role. Older mares generally have a tougher time recovering fertility anyway, even without pyometra. So for many of these mares, unfortunately, the goal has to shift. It moves away from future breeding and focuses instead on resolving the infection for her comfort and long-term health. It really highlights the dedication needed for these complex veterinary challenges.
We have definitely done a deep dive into equine pyometra today. Wow. From how subtle and sneaky it can be at the start to the absolutely staggering volumes of pus that can build up, and then the really challenging path to diagnosis and treatment. It's quite a testament to the complexities of veterinary medicine, isn't it? And also the incredible resilience of these animals.
It really is.
Yeah.
And I think for me, what stands out is how it powerfully reminds us that sometimes the most serious problems are the ones lurking just beneath the surface. They require that meticulous diagnostic approach and really dedicated, often quite prolonged, care to manage effectively. The body can hide so much.
Absolutely. And it makes you think, doesn't it? Consider this. Where else in life, maybe in systems or even in ourselves, might we be dealing with a sort of blocked drain pipe situation? You know, a chronic hidden problem where the obvious symptoms are maybe just distracting us from a deeper underlying issue that needs to be found and fixed rather than just treating the surface stuff. Something to perhaps mull over until our next deep dive.